Hey everyone, welcome to the Commercial Carrier Corner. I'm your host, Jared Taylor. Joining me today is the president and CEO of Connor Insurance, Ben Connor. Ben, how's it going?
It's going well. Thanks for having me.
Excited to have you here. Let's dive right in. Let's have you tell the audience a little bit about yourself for those that maybe haven't heard of you, and we'll go from there.
Sounds great. Yeah, I'm Ben Connor, CEO of Connor Insurance. This is our 75th year in business, and if you're seeing the visual, you'll know that I did not start the company. It was started by my grandfather, 1949. Really interesting story there as well. So we're a third generation family insurance agency. We do personal insurance, commercial insurance, and consultant employee benefits, and that's the practice that I lead is the employee benefits practice. So I've been doing this for getting close to 2 decades, and I've been really enjoying the journey. That's for sure.
How does a company stay around like that many years? You don't hear that nowadays. That's unheard of these days. So, what do you attribute that longevity to?
Yeah, I think first and foremost, it's God's grace that allows us to continue on like that. But secondly, our family dynamic has been really strong, just passing from generation to generation. My grandfather to my dad and his three brothers, so there were four boys. And then as they trained us up as third generation of what does it look like to run a business and treat it like a business, but also really pursue healthy family relationship. It's not easy by any stretch of the imagination, but at the end of the day, like we want to show up to Christmas and Thanksgiving, and we want to be able to enjoy important relationships uh, for the long term.
Well, here's to 75 more years uh, as well. That's incredible. Now, I would like to clarify, like, so while you offer insurance and HR consulting services, you also recently produced a documentary called "It's Not Personal, It's Just Healthcare." I would love to hear what inspired you to want to start a documentary like that.
Yeah, so I was really fortunate to be a part of a collection of individuals that contributed and helped produce the documentary. I think from my perspective, a couple of things were in play. Obviously, the main thing is healthcare is a complicated story that can be really hard to tell in one, a way that's entertaining, that keeps you engaged in the conversation, but one breaks something that's pretty complicated down into maybe some more simple bite-sized pieces so that you can understand like what's really going on. Um, so that was first and foremost, and I think with our brand, we want to when we do things, we want to do it with excellence. So as we kind of saw the team coming together and some initial things that were happening, we just saw that the excellence that was just dripping all over the film and the participants, and just we that was something we had to be a part of.
Can you share a few of the core themes and any particular stories that stood out?
Yeah, I think really the core theme, the core audience is business leaders, C-suite executives that are charged with uh, making decisions around the health plan within their business. Um, because uh, that's a hard thing to do. It's a seat that I find most employers don't want to be in. They don't want to be involved in their employees' health care, but the reality is that they are. And whether they're in manufacturing or in a service business or whatever they do, most businesses in the United States have a healthcare business unit, and that's through their health plan. So really just using this as a catalyst to tell them how important their role is. That's one element, but two, just to reveal like there is a business side of healthcare that they have largely been shielded from, and whether they admit it or not, they've relented to, they've given up control of to health insurance companies and hospitals and really the parties that profit the most when they are not involved and apply oversight. So this film is simply just to say, hey, here's what's going on, and this is a call that you need to be more involved because your employees, the American public, deeply depend on it.
Now, a big part of the documentary covers the backgrounds of healthcare's perverse incentives. How are large national insurers driving up the cost of care?
Yeah, I think when you look at anything, it doesn't matter if it's healthcare or uh, even like personal relationship. When there's a lack of transparency and a lack of visibility, that sets people up to make poor decisions. Um, and that's what's helped across the supply chain of healthcare is there's been no oversight. The people that are benefiting from the system are the ones that are creating the rules, and naturally, it's hard for folks that have been given that power and autonomy really to keep their hand out of the cookie jar. So whether it be insurance companies, facilities, pharmacy benefit managers, pharma in general, brokers, um, there's just no oversight, which has created a litany of perverse incentives. So, from to your question about the insurance companies directly, um, you know, they're the main perverse incentive, which is really lined out in the documentary, is the fact that the customer of the insurance company is not the member. Your employee that's a part of a health plan with whatever insurance company, that is not the customer. The customer for the insurance company is the shareholder, period. That is their fiduciary responsibility as an insurance company. So they will be looking out for their shareholders' best interests. They will seemingly make it as simple and easy as possible for their customer, which is the employer and the employee. But their financial incentives lie with their shareholders. So that fundamental situation, uh, is a misaligned incentive. And then furthermore, just the way in which they can make money, whether that is through um, just their profit and that sort of thing. There's a lot of regulation that really is they get there's incentive for prices to go up, and the documentary lines it out so well. But it's really important to understand as prices go up, insurance companies make more. If prices went down, they would make less, and largely that's due to regulation and just simple economics.
One of the things that's always been frustrating for me is it seems obvious to back pretty much every preventative like option of care. Um, it seems to me this is not every insurance plan does this, right? But like things like gym and even I would like to see more like food as medicine in the future, right? Backing as well if people can eat healthier. But the one that's been the most frustrating has been hearing that a lot of these scan technologies those aren't covered, right? And parts of it I get, but like, do you think we'll see an evolution of like still? I know their profits still have to, as you said, they're they're looking out for the shareholder, but do you still think, in many cases, if people are taking advantage of the preventative care options, um, that would be affecting the insurance company less? No, or do I have that backwards?
No, I think what you're bringing up is there's a lot happening. There is general a distrust for the machine, if you will, in American society, because over the last several years, our institutions have been um, we've seen that they've either not told us the truth or whatever that may be. And so I think the American public is asking more questions, which then leads us to um, maybe pursuing different outcomes. And to your point, maybe caring more about the demand side of healthcare. How are we engaging with our own health, with food as medicine, and those sorts of things, versus really entering into a sick care system and hoping that that will make us healthy. It doesn't really make sense that it would, but that's kind of been like the mantra. So that's certainly something that's going on. So I think that's interesting. I also think, um, and this is a theme of the documentary as well, is we have to bring humanity back into the supply chain of when people have to engage in a sick care system that we call healthcare. um, how is that financed? How do people afford that? How do we build something that really is a benefit? It's crazy to think that we title this an employee benefit, and it's pitched as that. However, if someone engages in a sick care system, they end up in medical debt or in collections or having their credit impaired or whatever that may be, simply for the fact that they can't afford the deductible that of the health plan that they purchase that costs them, you know, a $10,000 deductible and $10,000 out of their paycheck. Like, I mean, it's pretty wild, and we have to introduce humanity back into the system, or we're just perpetuating something that is really circling the drain, in my opinion.
Yeah, I find it interesting, that doctors take an oath to do no harm, and I do believe most of them set out to do that, but we have a system that, I mean, sometimes makes that difficult for them to follow, right? Because there's probably certain things that they should be recommending and maybe they can't. Um, so I think you make a lot of good points there, and I don't want to give too much away. If people want to learn more, they should go check out the documentary. And where should they go and find out more about that and watch it?
Yeah, so you can watch the documentary on demand from our website, which is connorins.com. So, and Connor is spelled Conner, and then ins.com. And if you go to the news and events, there's a tab there where literally you can watch it on demand. And we have there's some like graphics within the documentary, and we've made it available that you can download those too, so that you're not like, oh my gosh, let me try to take a screen capture of that, or however you're watching it, so you can kind of digest that along the way.
Ben, I want to thank you so much for joining us here today and telling your story and talking about this documentary, and wish you many more years of success. This is incredible that you guys have been around for this long and keep doing what you're doing.
Thanks, Jared. Thanks for having me.